Welcome everyone to the June 2021 My HR Genius webinar series. It's our HR Best Practices series, and we're very happy to present to you. And I say we because for the first time ever, I think, it'll be 9 years in August of doing these webinars, I am joined by somebody else. So I have Elaine Luthens, or Laney from our Minnesota office, like myself, and Laney is on the line, and she'll be joining us in a minute, and we are going to co-present on this one. And so there have been a few other co-presenters when I've not done the presentations over the years, but this will be the first time for me, and so I'm really excited about it. My name's Kevin Mosher. I'm an MSBA Labor and Employment Law Specialist, and like I said, I'm joined by Laney, who's an attorney here in our Minnesota office with me. And this month, we are going to talk about returning to work and continued remote working in a post-pandemic. It is, without question, a topic that if you are in HR or a worker of any sort, that you are absolutely dealing with it. It's it's definitely like one of those topics that's just impacting absolutely everybody. Some businesses continue to be closed and are focusing on remote work. Some are going to be transitioning in great portion to remote work, and then also but then some businesses have started to come back, and there's just a lot of all over the board. But for those businesses that are thinking about coming back, transitioning back after being gone for probably the better part of the last year plus since COVID took, there's a lot to be thinking about, and there's also a lot to be thinking about with regard to remote workers, cultural issues, compliance issues, and just a lot of things. And that's what we want to talk about today during the presentation. So, getting to that, I welcome you. If this is the first time that you are joining us for one of our My HR Genius HR Best Practices series by Thompson Co. Welcome. And if you are not a member of our My HR Genius plan, you are welcome to join. It's a month-to-month program. And for a base price of $79, it doesn't matter what size your company is, you can call or email us with any of your day-to-day HR type of questions or strategy discussions or compliance questions. Happy to talk about cultural issues, but anything that you really need from a day-to-day standpoint on HR to bounce something off of an HR attorney, we are there for you. And so we would welcome you onto the program. You're welcome to reach out to us or look at our website at myhrgenius.co, not .com, .co. Services that you get with the program include the hotline, which is unlimited. You can call every day if you want. Obviously, these sorts of webinars. We also do podcasts. Laney has done podcasts with me, so we've had some experience in tag teaming these sorts of things. And then we do weekly updates, tips of the week, and so it's a whole compliance strategy help and education program, all for $79. So a pretty good deal. And if you're interested, like I say, you're welcome to reach out to us at any time and try out the program. So today we are, I'm really excited, Laney's probably super excited too. So we're going to talk about this return to work and what the workplace, what work from home looks like. And again, it's going to be, returning to work for a lot of companies in the manufacturing setting, their blue collar production type of employees really probably never left, or they were laid off or furloughed, if you want to use that phrase, in that sort of status. So there's, it's very different than in a professional white collar type of environment. If you're in, computer software design or something like that, working from home is just a very different thing than in a production facility. So there's just going to be all around, all over the board approaches and considerations that HR people, have to think about. So we are going to look at some of the best practices, and you might have some other ideas and all that. And then we are going to talk about maintaining remote workers and remote work from home policies, something that is becoming increasingly common. I'll tell you, like our law firm just rolled out something like that in the last week or so. And, we're not alone. A lot of law firms, a lot of professional firms are doing that sort of thing, putting into policy consideration the remote work and what it looks like and who's eligible and the things that you need to abide by and how the rules affect you. All those sorts of things really should be put into a policy if you want to do this. We're going to talk about some cultural issues as well along those lines. The sorts of considerations that you might need to have if you're doing that, and who are you attracting to work for you in the future? What are the expectations of employers? That sort of thing, because I do think the expectations have changed in the last 15 months or so since COVID became a thing, and there's a lockdown. I mean, it's just, I think it is, especially with regard to the workplace, I think there are just a lot of changes that are going to be more permanent, or they've accelerated changes that were already in place for a lot of employers. But I think just across the board, we're going to see a lot more changes going forward and acceleration of those changes. So, and then we're going to talk about some refresher legislation. There's still some stuff out there. A year ago, it was FFCRA all day long for employers with less than 500 employees. And, that's not so much the case. Now there's a voluntary FFCRA instead. And then there's also some issues, some considerations with COBRA stimulus payments as well that we're going to refresh on. And obviously there's also, for a lot of states that haven't rescinded the federal unemployment sweetener of like $300. So that's obviously in play here in June of 2021. That's impacting unemployment rates and that sort of thing. So let's move on. Oh, and I do want to say that if you need your HRCI or SHRM credits or CLEs for the states that we've applied for, then you once we confirm attendance here, you should get within a few days or certainly within a week, you should get a certification confirming your attendance here that you can use for your HRCI and SHRM credits. Okay, so returning to in-person working. So we've got our fun office here, right? Fortunately for the office, when that TV show was on, everybody was actually working in the office. Otherwise, it would have been a pretty terrible TV show. Although it would have been funny to see an office season during the COVID pandemic. So, what does returning to work look like? What are some of the things that employers should be doing? So, at a fundamental basis, and we've talked about this a lot the last year. Obviously, OSHA has been a big topic, and whether or not COVID is a hazard and all that. But just as a fundamental rule, if as an employer, you have an obligation to maintain a safe work environment. I don't care if it's COVID. I don't care if it's having people walk on the rafters. I don't care if it's having people climb poles. I don't care if it's having people wear other sorts of PPE. You have an obligation to maintain a safe work environment and to remedy or address known hazards. Now, the government hasn't called COVID a hazard, right? And we've talked about that. Again, for those of you that listen to our podcast and listen to me talk about these workplace issues, that OSHA the federal government has not considered COVID to be a hazard. That being said, we still want, as a good employer, and then also in compliance with federal rules, we want to make sure that we're maintaining a safe work environment. So even though the pandemic is kind of fading away as people get vaccinated, not everybody, there's a lot of people that aren't getting vaccinated. So the workplace is going to continue to be a potential problem for them. So just coming back into the same old workplace, depending on how it's set up, office-wise and space-wise and operationally, you might have to make some changes. You might have to, your safety people, whoever is doing, your safety consultant or your safety person, or your office manager should still be going around and identifying unsafe things. The sanitizers should still kind of be around. I don't, we now know that COVID is more of like an airborne type of thing, and we maybe a little bit of overkill uncleaning surfaces and that sort of thing, but that's okay. We're all learning. But still, we might still want to implement cleaning protocols. We might want to have maybe you still want to have masks because a good percentage of the workforce is not vaccinated. And so maybe as an employer, you want to continue to, as part of your duty to maintain a safe work environment, you want employees to continue to wear masks. Maybe you're going to mandate vaccinations. We'll talk about that in a little bit. But at a general fundamental rule, you need to maintain a safe work environment for employees and also for guests and customers, that sort of thing. You're going to need to develop clear policies and procedures. What does that look like? Are we going to have a new cleaning protocol? Is there going to be a mask wearing protocol? Is there going to be, are we going to separate the desks a little bit? Are we going to work different sorts of shifts or hybrid shifts where some people are coming in, where some people aren't? Based on your business, you're going to want to have policies and procedures around this. And this is all going to have to be thought out before you return everybody to the workplace because, like I say, even if most of your people are vaccinated, there's still going to be some changes that you're going to need to implement. And then, the third key is to then communicate it. So once you develop the policies should be in writing, and that communication to those employees needs to be made. Now, these sorts of policies, it's great if you have people sign off on them. It's not as critical to have somebody sign off on a policy that because it's not like a misconduct sort of policy, like an attendance policy or an employee handbook. It's just a communication of what your expectations are regarding like cleaning and safety, distance, that sort of thing. So ideally, in a perfect world, we have everybody sign off on it. But if it's just sending an email out to people, notifying them of what the expectations and guidelines are and procedures, that's fine too. But the key is that we communicate it, right? We communicate to the employees, make sure they all understand what we expect when they return to the workplace, what it's going to look like for them, and what they're expected to do, and what the options are, if they can work from home potentially, if they can hybrid, whatever it is. But whatever that policy is, we need to structure it. It needs to be well thought out, and then it needs to be communicated. And maybe you need to do training on it, but probably not. It's probably the sort of thing that you can just kind of explain it. You can explain it to people. Lainey, I have talked, and I'm so used to talking for the entire 60 minutes of these webinars, so I'm going to force myself to stop and hand it to you to start warming up your vocal cords. And so if you want to talk about workplace safety, I think this would be a good opportunity.
Okay. So the first topic of getting everyone back in the workplace is obviously making sure that it's safe. And we've already, talked about this quite a bit. I think last month's webinar was on it too. So this might be more of a refresher than anything. But in order to make sure everything's safe, we want to first make sure that we're complying with any state or local COVID-19 restrictions. We know that a lot of those are getting, they're removing them, I guess, eliminating those restrictions in a lot of places, but there are still some in some places. So you want to be cognizant of that because that's an easy way to ensure that you're complying if you're, complying with the actual laws in place. So next, there's been some new OSHA guidance, which we'll discuss in a bit here. So OSHA has actually released some new guidance for all employers and an emergency temporary rule for employers in the healthcare industry. And then there's also the CDC guidance, which is just guidance. However, compliance with the CDC guidance is a good way to ensure that you're, providing a safe place for your workers and your customers. And then you'll want to look at industry-specific guidance, and then you'll also have your own internal safety policies that you'll create and develop and hopefully communicate to your employees and any other customers or guests that they apply to. Okay, so like I mentioned, though these workers have probably already been in the workplace throughout, the pandemic, because this is an emergency temporary standard, this does create a legal obligation. So I figured we would touch on it quickly just for anyone who is in this industry and this applies to. So this went into place June 10th, so just a few days ago, not even a week ago. And it applies in all settings where employees provide healthcare services or healthcare support services. And there are some exceptions to these rules and guidance put out under this emergency temporary standard, and that's for when all employees are vaccinated and all non-employees are screened, and they're in well-defined areas where there's no reason to believe that COVID-19 could be present. Okay, and so under this emergency temporary standard, employers with more than 10 employees, so this applies, do need to create a COVID-19 plan in writing. And some of the things that these plans need to include is, something for monitoring point of entries to make sure that patients or anyone that enters are screened for COVID symptoms, providing everyone with PPE, having a written procedure or some sort of procedure in place for isolating anyone who comes in who has COVID-19 symptoms or tests positive for COVID-19, and then a procedure for cleaning wherever they are after. And then your standard, social distancing, physical barriers, and then cleaning and disinfection policies, as well as having some standard in for maintaining adequate ventilation. Okay. You also want to make sure that you're screening all the employees for COVID-19 and notifying other employees within 24 hours if you know that they were exposed. An interesting part about this updated emergency temporary standard is that employers with at least 10 employees are required to provide benefits to employees who are required to quarantine, due to having symptoms or a positive case or exposure. And employers should provide time off for employees to get vaccinated. It also contains, an anti-retaliation part. So employees can't be retaliated against for, bringing a COVID-related concern, especially if it falls within this standard, to the employer's attention or otherwise complaining about it. And then the last couple bits here to establish a COVID-19 log, and that again only applies if there's 10 or more employees under that employer. Reporting people who are employees who either die from or are hospitalized due to their COVID-19 diagnosis, and reporting that to OSHA. And then, like I mentioned earlier, there are some exceptions when we're dealing with fully vaccinated employees, and all the employees are fully vaccinated, and there is no, reason to believe that COVID may be present among those individuals. I'm not sure if Kevin has anything else to add on those.
The only thing I would add is, and I know we might have addressed it in a future slide, but there was a recent lawsuit in Texas against a healthcare system, and a large healthcare system that mandated vaccinations for employees. And I think out of the mandate, there were, I might be totally wrong on this, but I think it was like 180 or so of the employees were fired for refusing to be vaccinated, and then some of them brought a lawsuit. And I think I don't think it's a coincidence that this OSHA guidance came out, and then the healthcare system, the hospital system, issued this mandate, right? And they gave some time, obviously, for people to do it, but it is surprising that a lot of healthcare providers are not, up until these OSHA guidelines, have not been mandating vaccination for their employees. So anyway, this is the first lawsuit that we've seen against, at least a healthcare employer for mandating vaccinations, and it was thrown out, and appropriately so. I mean, the EOC has made very clear that employers can mandate vaccinations. We'll talk about that more in depth in a minute. But I do think there's some correlation here between this OSHA guidance and some of these exceptions that are made for healthcare providers that have a fully vaccinated workforce. And what I expect to see is an increasing expectation and rollout among healthcare providers of mandatory vaccination rules, which we have not really seen all that. Well, obviously, we've seen here and there among a lot of employers, including healthcare, but we really haven't seen a major push by any industry of mandating vaccinations for all their employees. So that's the only thing I would add, Lainey.
Sounds good. Yep. Okay. So in addition to the emergency temporary standard, which, created legal obligations on all the employers that it affects, OSHA also, issued some just general guidance to employers in all the other industries. And so this guidance is, for the most part informal, and it doesn't create any legal obligations. It's just, OSHA providing some clarifications as to, policies that it recommends or, how it views certain policies, basically. So an important thing to note about this new guidance is that it specifically said that employers don't have any COVID-related obligations toward fully vaccinated employees. So if your workforce, is fully vaccinated, each and every one of them, then you can pretty much, you don't really need to consider this updated OSHA guidance since, OSHA is to protect your employees and the workers. So it clearly said, once everyone's fully vaccinated, you don't have any more COVID-19 related obligations towards them, at least as far as OSHA goes. And basically this guidance was aimed at how employers should, what efforts they should take to protect either their non-vaccinated employees or employees who are more at risk, even if they, have been vaccinated or, can't get vaccinated for some other reason.
There was an interesting, the only thing I would add to that is there was an interesting study, I think it was just in today's or yesterday's New York Times about, and they actually looked at Minnesota statistics, and they looked at hospitalization. People who have been hospitalized, who are currently being hospitalized for COVID, and 99% of the hospitalizations, at least in Minnesota, and then there are some other states that it was like 98% or something, but it's almost 100% of the COVID hospitalizations are people who have not been vaccinated. So whether it still doesn't seem to be a lot of children under the age of 11 who can't get vaccinated, but it seems to be for the most part adults that have either chosen not to be vaccinated or having a difficult time getting vaccinated, or because of health, their own personal physical health related reasons, or I suppose religious reasons, whatever the reason is, have chosen not to get vaccinated. So it's this is an indicator to employers that if you have a high population of unvaccinated employees, this increases the expectation that you should be, reviewing your safe workplace rules and procedures and all that, and roll out something versus a workplace that has a highly, vaccinated population of employees. You might not have to think about it as, the return to work as seriously as the employers who have the flip situation.
Yeah. Yeah. Okay. And so I'll just go over some of the guidance that they provided. It's also a lot of, policy suggestions. And so even though this is just informal guidance, it may, be helpful for figuring out, what policies to implement and how to best make sure that you're complying with your obligations to maintain a safe work environment. So the first one would be to grant PTO for employees who need to miss work to go get vaccinated. So this is actually part of the voluntary FFCRA under the American Rescue Plan Act. So what the American Rescue Plan Act did was it expanded the reasons that people can get the emergency paid sick leave and also the Emergency Family Medical Leave Expansion Act leave. And so one of those reasons is to go get vaccinated, and also any time that they miss for if they're experiencing an illness or some sort of side effect as a result of the vaccine. And so if you are participating in the FFCRA still and providing that, any time off, you could get reimbursed for that, all those wages you pay. It is PTO or, FFCRA leave. The next one is pretty obvious, tell employees if they've tested positive for COVID-19, or if they're not vaccinated and they have had a for sure exposure to someone who tested positive for COVID-19, to stay at work and quarantine until, it's safe for them to return. Implement social distancing for unvaccinated employees in communal work areas. Provide unvaccinated and at-risk workers with masks to make sure, they're not spreading it among themselves. And then just continue, training on your COVID-19 policies and procedures, and, providing information to employees on, the risks. And as I'm sure we've all been well aware after dealing with this for 14, 15 months by now, but, continue those efforts. Encourage any unvaccinated people who enter your facility to wear masks. So, keeping that policy in effect, or, putting up signs or otherwise informing people if they're not vaccinated, they should wear a mask in the building. Maintain your ventilation system, since that's been shown to help, avoid spreading COVID around indoors. Routine cleaning and disinfection, recording and reporting the COVID-19 infections and deaths, and then, making sure you have policies that protect employees from retaliation if, they raise any concern that any COVID-related safety policies or guidance isn't being followed in the workplace. And along with that, setting up an anonymous way for your workers to voice concerns about COVID or anything related to it that they may observe in the workplace. So in addition to that, OSHA also provided some guidance about workplaces that have some workers that are vaccinated and some that are not. So you need to be more careful and take more precautions when there's more close contact among, people who are unvaccinated and they're going to be in contact for longer durations of time, or they're going to have frequent contact with unvaccinated people or at-risk populations. So some examples of these kind of industries are like manufacturing, food processing, or high volume retail, or like grocery stores, like Target, places like that, where, you know, the employees, even if they're vaccinated or if they're unvaccinated, they'll be encountering a lot of other people who they don't know their vaccination status just in the course of their workday. So some ways that OSHA has recommended to, you know, curb these risks to unvaccinated employees is staggering the break times, arrival times, and departure times. Kevin kind of mentioned that earlier. Requiring masks for unvaccinated workers and guests or customers or anyone who enters the facility. You know, keeping the social distancing requirements, especially between unvaccinated workers and customers. So, you know, maybe having the unvaccinated employees work in areas where they're not as directly, they're not as close contact to customers, maybe. And then schedule unvaccinated workers for off-peak hours. So, you know, hours when they're not as likely to interact with as many customers or as many other employees, especially in close contact or frequent contact or for longer durations of time.
Yeah, and this is the issue. Like, this is, I knew this slide was coming, so I was like, I was going to say something, but the overall question is, well, how can we implement these sorts of things if we don't have the information? And the answer is, you can get the information. A lot of people incorrectly, I hear all the time, you know, oh, this is a HIPAA, like we're worried about HIPAA. It's not HIPAA. It's been made very clear by the government that asking about somebody's vaccination status, asking whether they've had COVID, but more importantly for this purpose, asking whether they've had the COVID vaccination is not a medical inquiry. And HIPAA really doesn't apply to most employers. It's really more applicable to hospitals and medical providers and the documentation that they keep on employees. That being said, there are limitations around asking people about, you know, disabilities and all that, but that's not a question of whether or not the person has vaccination. So it's really clear that, can you poll your employees, your workforce, and ask whether they've gotten the vaccination? Yeah, you can. And I think you're going to need that information if you want to implement some of these, especially if you have a hybrid workforce where you're trying to implement policy and you're trying to figure out, like, okay, well, how are we going to apply it to this group of people or this person and this team and that team? We need to have the data. We need to have the information about the employees. We get a lot of questions about, you know, who should be doing this. So in my mind, and it's easy to say this to a group of HR people and labor and employment attorneys who are likely to listening to this webinar, it's easy to say HR people and internal legal should be handling this. It should not be supervisors, because there are some questions that would not be appropriate, right? So if they dig too deep and they ask too much about medical history and disability, like those are some things that are protected by the ADA. So there are certainly some limitations we want to watch out for. And so putting this in the hands of direct supervisors and managers who don't have HR training, and they might be great at their job, but they're not great at HR at all. This is something that should be rolled out through the executive leadership, through HR, through legal, to find out, you know, who has what's the plan, and then what are you going to do with the information? Like, how are we going to store the information? How are we going to disseminate the information? You know, even if it's not a HIPAA violation, it doesn't mean you want to go broadcasting it out to everybody. I would still secure the information. I would only distribute it to people who are on a need-to-know basis, and I would only gather this information if you're going to actually use it. If you're not going to do anything with it, if you're not going to implement a plan, if you're not going to somehow use this information to change your operations or to make, you know, address safety concerns and that sort of thing, then don't gather the information. then you're just like getting it. It almost seems like gossipy. But if there's going to be a purpose ultimately for getting this information on who's been vaccinated, what's the plan to be vaccinated, have you had 1 or 2 vaccinations, then if you're going to do something, potentially do something with the information, then it's a good idea, and I would absolutely do it, and because I think you're going to need it to do a lot of the things that Lainey had just described.
Yep, that's right. So you can totally ask which employees have been vaccinated, and you should if you're planning to do one of these planning to implement one of these policies that differentiates. Like Kevin said, if you want to have a policy like that, you're going to need the information for it to be effective in any way. But the main warning sign in this is just don't ask anything else. Don't ask why they didn't get vaccinated, because that can really turn into a slippery slope and could, result in making a disability-related inquiry that you don't want to make. Just keep it simple. Ask, have you been vaccinated? Yes or no. And if you want to require proof of that vaccination status, then you can do that. And another good idea, if you're wanting everyone to get vaccinated, but you're not necessarily trying to, mandate it, or you don't want to ask people, like I said, why they're not getting it. Provide information on, how they can get the vaccine, and then also you can provide information about how they can request an accommodation if they want to, engage in that because they're unable to get vaccinated due to some protected reason like a medical disability or a sincerely held religious belief. So that way employees know how to do it, but you're not asking that yourself. Okay. And so then next, if you're an employer that, invites customers or guests, or, you have a lot of other people aside from your workforce in the workplace, and you still want to make sure it's safe, but how can you figure out whether or not those people have been vaccinated? So this depends a lot more on the state that you're in. So you probably heard about some states passing, laws banning vaccine passports. And some of these are to various degrees, like either they've said like their state government isn't going to create them, or state governments can't require them, but some have gone to like actually regulate private businesses and say you can't ask your customers about their vaccination status. And the last I checked, that was Florida, Texas, and Montana. So if you operate in any of those states, that's where you're not allowed to ask customers if they've been vaccinated or ask for proof of vaccination. But you can still maintain a policy and say, sign to say unvaccinated people have to wear masks, or, socially distance if you're vaccinated. It's just you kind of have to go on a good faith policy if that's the case, since there's really no way to verify when you can't. And there's also, some business considerations, if you live in a place where that might, deter customers or guests, then it might not be the wisest move. But you do have some legal restrictions if you're operating in these certain places.
Yeah, and to this point, this gets back to just the general idea that you as an employer have control over your property. It might not feel like it some days, based on all the government regulations and everything, but you do have control. So if the government, I think most states have now dropped the whole like mask mandate and all that. So I don't even know if there's any state that has a mask mandate. There probably are some cities and states out there, but not many left. But that doesn't mean that you can't require masks. You can absolutely require masks. Now you might have to look in a few of these crazy states that have passed just nonsensical laws restricting property owner rights, which makes no sense to me whatsoever that Texas would restrict property owner rights to the benefit of individual rights. Like that, I thought that was a California and a New York thing. Illinois and a Minnesota thing and not a Texas thing, but apparently Texas is now like all into individual rights over property rights. So except in a couple of these areas where you might have to just kind of check it out, you have property rights as an employer. You can set, whether it's for customers or employees, you get to set the terms of who you're going to work with. Now, obviously, there's some, you can't discriminate against people with disabilities, and there's some restrictions on that. But, you can require, if you want employees to get vaccinated, you can require that they wear masks. You can require that they don't come in if they're sick, if they potentially have they have COVID. You can require that they take off time from work if they're sick without pay. You have a lot of power here. The mask mandate was that was like a minimum requirement under police powers that a lot of states had implemented. But you can still do a lot more. If you're worried about safety and all that sort of thing, there's a lot that you can do. And there's, I really don't think there's any laws out there that say you cannot. I mean, there are a couple with the, Texas with the passport thing. But other than that, you have a lot of leeway and flexibility in how you want to make requirements of who you're going to have for customers and who, what they're going to do, and then your employees as well, how you're going to treat them and requirements that they have if they want to continue to work for you.
Okay, so now I was just going to go through some, potential policies, say whether or not they're good or bad. It's kind of like a test, I guess. But and these are all things we've gone over. So, requiring unvaccinated workers and customers to wear masks. If you have, just rely on good faith, that's okay. If you require disclosure of vaccination status, that's okay as it applies to your employees and customers if you don't live in one of those states like we mentioned. Require proof of vaccination, okay for employees, probably okay for customers unless you're in one of those states. Require everyone to wear masks, like Kevin said, you can do it if you want. That's totally fine. Whether or not you want to send out a vaccination survey to get everyone's, status, totally fine. You're going to need to do it if you want to implement any of these policies that differentiate between vaccinated and unvaccinated people. If you want to include in that, why didn't you receive the vaccine? Not a good policy. Like I said, we don't want to know why. And if you plan to receive it, that would be fine to ask. If you want to have a vaccine mandate, that's all good, so long as, you're making accommodations for, individuals who can't get it based on a protected reason like disability or sincerely held religious belief. So you want to have a policy where you encourage vaccination, that is totally good. Like providing information and resources for receiving it, totally fine. Providing information for requesting an accommodation because they can't receive a vaccine for a protected reason, that is good and encouraged. This is sort of just reiterating what Kevin already said, but as the employer,
I always jump the shark
the
on these. Yeah. You make the rules.
You get to set the terms. Wearing a mask is just like any other sort of, safety equipment. You require workers or employees to wear like goggles or gloves or something. So you have a lot of discretion, especially in making it safe. So
I did a podcast. We did a podcast about this at the very beginning of COVID. Like when COVID, before any of the shutdown and everything. And it was the same stuff. Like nothing really changed. Like the laws, the rules never really changed. They just applied to a new pandemic. And obviously it was a much more extreme situation, but the rules have continued to be the same, that you as an employer have the ability to make the rules, that you have the ability to control the requirements and the rules within your property. Obviously, the mask mandate was a new thing that government started forcing on employers. But your fundamental obligation to maintain a safe work environment has not changed. OSHA never changed it. They just issued for the first time guidance just limited to healthcare healthcare workers, and then, obviously with the other guidance for non-healthcare workers. But again, it's just guidance, and it's not, your fundamental obligation is to maintain a safe work environment. Whatever that means for you, that's what you need to do. And you have a lot of flexibility in doing it to get there.
Okay, so this is just a recap. So best practices for returning to in-person working in the workplace or the office is establish your policies, communicate those policies and your expectations to your employees clearly, inform customers or anyone else who may be affected by the policies of those policies so that they have a chance to comply. Make sure you're complying with any relevant laws, which would probably just be like state laws or any local ordinances that are still in effect, which are dwindling, so probably not any, at least not any in the future. Okay. So now this is switching over to employers who want to continue these remote work arrangements, either have some of the employees work remotely or have all employees work remotely some of the time, or have some sort of policy that incorporates remote working. And so these are the main things to discuss is, you still need to have a safe workplace for your employees. The big thing to remember is the state and local laws where these employees are actually working. So even though you're a company based in one state, if you have an employee working in another, that could subject you to making sure you comply with all of the laws in which the state of which where the employee works. So these can mean leave laws, like expense reimbursement laws, personnel file laws, even like state insurance programs or state paid leave programs. Drug testing laws is one example. It's important to figure out a good system for tracking the employee's time when they're, not in site, and then maintaining communication with your employees.
And to this point, I mean, you have to look at unemployment, you have to look at work comp. This is all these things, and this is also made hard when some employees don't tell you that they've moved to another state. But hopefully eventually you find out, and then after they've been working in the state for a long enough period of time, they probably trigger residency requirements. And so just you as an employer need to understand that whether you know it, whether you wanted to or not, you might have just become a multi-state employer. This will, I will tell you, Lainey and I have been spending a lot of time the last year updating employee handbooks, doing state supplements, for employers that just never envisioned having employees in, states all over the country. This is, I know how much HR people love to work on employee handbooks, but now there's a lot more need to do so whether you want them to or not, are starting to spread around the United States, and you're just now suddenly they're bringing you into needing to understand the local laws. And that's a big deal, and obviously Thompson Hill can help with that. But it's it's interesting, I guess, but it's also a potential problem for a lot of employers that never envisioned wanting to be in that situation.
Okay, so I just start out with some statistics and polls regarding employee preferences. So I know some employers, might be making these decisions based on, what their workforce wants to do, which is nice of them if they do. So this was a poll, I think it was in April, and it basically showed that across all age groups, so that most people working in America prefer to work remotely at least some of the time. So, some people, so I think it's 19% preferred to work remotely 100% of the time, and then 41%, so that's like the plurality of everyone surveyed, is that they wanted to do a mixture of both. And the main disparities between this were between men and women. However, they weren't really that great. So, and the one thing I found interesting was that one survey showed that 64% of the employees surveyed would rather work from home indefinitely than take a $30,000 raise. So people really like working from home.
That's very surprising to me. I actually thought the funniest part was that 14% of the employees don't want to work at all.
Yeah.
I guess that was a question. Like,
Ideal preference, no work.
Yeah. Ideally, I would not work at all. So
yeah.
I guess maybe the enhanced unemployment benefits help facilitate that desire.
Perhaps.
So, yeah.
Yeah. Here's just some more trends, and I think this is more recent. Yeah, back in May. So these were showing what most employers were doing. So most employers, or I guess a plurality here, 19% said that they would be bringing everyone back between 1 to 3 months. Most of the ones surveyed said by the end of the year at least, everyone would be back in the office. And this was sort of the same result as the other one that everyone surveyed here is most people would rather work from home only or work from home and in the office. And this was another interesting one, which I think a lot of employers are probably curious about, is what the reasons why people are concerned about returning to the office. And the biggest one is just losing the flexibility they had, from before when they were able to work from home. And, then like getting back into their old routine. And then the next ones are kind of about, or the most cited ones after that are mostly about, COVID protocols, like being around people, being around vaccinated people, if social distancing isn't maintained, just having to share spaces and appliances, and then like traveling and then doing the things that come along with working in the office, like going to in-person meetings.
Yeah.
Okay. So the first thing that we want to touch on is just safety again. Employers still have a general duty to have a workplace that is free from hazards. However, OSHA specifically says that it's not going to regulate or inspect home offices, so you don't need to be as concerned in that respect. However, there is always, the risk of like injury or something that is directly related to work, which could trigger a workers' compensation claim or just like any sort of general liability. So you just want to make sure employees are aware of that and they're trained on it, and that, here's, I guess I'm jumping ahead of the next slide, is that, you provide information about setting up equipment to make sure everything goes okay in that regard, checking in with employees on safety issues, making sure they're trained on their obligations to report injuries, and then creating a system for employees to communicate any concerns they have or report injuries. Okay, so this is a big one that I'm sure Kevin would agree that we've dealt with quite a bit since everyone has transitioned to remote working, is about what employers have to reimburse their employees for. So there isn't an overall like federal law regarding employment expenses, but you can't require employees to purchase things for the purpose of their job that would make their wages fall below minimum wage. That said, there are some states that have clear expense reimbursement laws, and the most expansive ones are probably California and Illinois. So in California, employers can be required to, provide some reimbursement for cell phone usage, computers, Wi-Fi, printers. So even if these are things that employees would just have regardless, if they're using them for work, then employers can be on the hook for paying for some of it. So if you have any employees working in California, you want to be cognizant of that even if you're not a California-based company. In the Illinois rule is similar, but it does have a caveat that if you have a written expense policy, so long it's clear and your employee, like that, how the employees comply and submit requests and have a time frame for doing so. If the employees aren't complying with that written policy, then you have sort of an excuse if you're not reimbursing in accordance with the law to a T. So the main advice is make sure you have a clear written policy so employees aren't confused. They know what they can request reimbursement for. You know, you're covered if you have employees in these states that have express reimbursement policy laws. And then, so yeah, so that way everyone's on the same page and you can ensure that you're complying with the law and that your employees know how to claim the expense. And so this is kind of touched on already, but like what Kevin said, is when you have employees living with and working within a state or city, you as an employer can then be expected to comply with whatever laws or city ordinances apply to that location. So there is a big example of this is in, you know, the Twin Cities. Both Minneapolis and St. Paul have their own sick and safe time laws, or ordinance, I should say. And so if employees are performing work within the city of Minneapolis or the city of St. Paul, they're accruing sick and safe time, and employers have to track that and, you know, comply with all aspects of the ordinances during that time the employee is working in the city. Another example is that Massachusetts has a Paid Family and Medical Leave Act, the Illinois, California, and expense reimbursement laws like we discussed. Montana is the only state that doesn't have at-will employment. So if you have an employee there, that's something to note. Minnesota has a personnel file law. And then Iowa has a drug testing law that's, you know, stricter than all the other states. So these are just sampling. There's a lot more out there, but it's just to kind of highlight that if you have employees working in other states, you need to have a policy so that they let you know, so that you know which laws you're supposed to comply with, and you can ensure that you are complying with them. Okay.
This is just, yeah, and this is just reiterating what the federal law for wage hour requires, that you track the time. And that just might be something that, you know, a lot of employers have online tracking systems, whether, you know, you're using ADP or whatever the payroll software is, or the time and attendance software that you're using. And so, you know, it's just to know that it continues to apply to at-home workers, you know, remote workers if they're non-exempt. If they're exempt, it's different, and you continue to pay the salary. But for non-exempt workers, you still have all the requirements under federal law that you had before. And then, like we've been mentioning, there are a number of states that have like mini FMLA or other sorts of paid leave, especially, you know, that's a growing area. We've done lots of webinars on that if you have any questions. But obviously, if you've got an employee who now is remote working out of like Massachusetts or California or New York, you know, and you're a Minnesota-based employer, they're going to be entitled to potentially to different paid leave benefits based on like family leave or sick leave potentially. The other thing is to look at the application of the FMLA. A lot of employers with remote employees will just continue to count those employees within the 75-mile radius, or they'll just say, well, that's your home base. You know, even though you're remote and you're working in like Washington and your base is Minneapolis, we're still going to count you for FMLA purposes. But that's not necessarily what you need to do legally. If you want to do it, that's fine. But legally, you can literally draw a 75-mile radius around that person's new remote work site to see if they have 50 or more workers within that to be eligible for the FMLA. I think we already talked about this, so I'm going to skip that one. And then we already mentioned, and then we're just going to wrap this up, but Lainey already mentioned the American Rescue Plan Act, which that and the voluntary FFCRA, includes the COBRA subsidy. So it's just a reminder, we've put out a lot of information about this COBRA subsidy and the FFCRA voluntary leave. So you're welcome to look at our website on that. And if you're on the My HR Genius program, you can look at the tips that we've been sending out on. But these both end in September. I don't expect they're going to be extended, but the COBRA subsidy is pays for COBRA, and then the employer, you as the employer, would pay for the person's COBRA if they elect it through September. And then you would get reimbursed dollar for dollar for the premium that you're paying for them. So the employee kind of gets like free COBRA, not even kind of like actually gets free COBRA. That's reimbursed by the government. And then similarly, a lot of employers have not taken up the mantle of continuing the FFCRA, which is understandable. There was a lot of abuse of it in 2020. But it continues to be out there, and it's available for expanded reasons, and employees got extra weeks, beyond what they got in 2020 for that. And then just overall, like I said, we just want to reiterate, there's safety requirements for employers. You want to have policies, and you want to communicate these things. And again, what it looks like for your workforce is going to be very different than your neighbor's workforce. But there's just a lot of, hopefully we've covered a lot of the guidelines that at least you want to consider so that you can implement this going forward and have these considerations as you're ready to return to work, or maybe you've already returned to work and you need to make sure that you cover everything. So we are done. 1 o'clock Central, and the next webinar, I am going to tag team it with somebody else. Lainey, thank you so much. It was fantastic, and I was so excited to do it with another person. And next month, I'm going to do it with Farshid out of our Dallas office, and we are going to cover So You Want to Understand the Impact of New Laws and Regulations. This is our mid-year legislative update. What have states done, and what has the federal government done, if anything, under a new administration? What do the new regulations look like? What do new laws look like? That sort of thing. And we're going to talk about them and bring everybody up to speed for 2021 in a month. So thanks so much. If you have any questions, you're welcome to reach out to either of us at any time. Our contact information is here. We hope you have a great week, and thanks for your attendance.